Hi, I'm Dr. Danny Shaban with Dominion Women's Health. I'm a board-certified OB/GYN as well as laparoscopic surgeon. I'm the director of robotic surgery here in Richmond, Virginia, as well as the director for the Epicenter for Intuitive Surgical. Why are we here today? Is to learn a little bit more about the changes in your body, to discuss illnesses or chronic conditions affecting you, your family, and friends, to answer some common questions related to hysterectomy procedures. We're going to go over some benign health issues, gynecological, urologic, cancers, menopause with osteoporosis, overweight, and obesity. Looking at the anatomy of the uterus, you have the endometrium and the myometrium, which is within the muscle of the uterus. We have the fallopian tube, the ovaries, which contain the ovulatory eggs, cervix, and the vagina. Elements of your annual exam will include the physical exam, the history, some of the diagnostic procedures such as pap smears, HPV testing, genetic testing, especially for like cancer risk factors, BRCA testing, pelvic exam, also can be a transvaginal ultrasound, as well as blood work. If you have symptoms or risk factors, to ask for additional testing such as ultrasounds, MRI, X-ray, CT scan, a hysterosalpingogram, laparoscopy, or even a hysteroscopy in which we look into the uterus itself. What is a hysterectomy procedure? A hysterectomy is a surgical procedure whereby the uterus or womb is removed through an abdominal or minimally invasive surgical technique. This surgery for women is the most common non-obstetrical procedure in the United States, with approximately 300 out of every 100,000 women undergoing a hysterectomy in the United States. Open hysterectomy procedures are an abdominal hysterectomy where an open surgery is made. This is made by using a 5 to 7 inch incision, allowing the surgeon to remove the uterus. The hospital recovery is on average 3 to 5 days more, and you're back to work within 6 to 8 weeks. Looking at minimally invasive hysterectomy procedures, we have vaginal hysterectomy, in which the surgeon makes an incision inside the vagina, allowing removal of the uterus through a vaginal incision. As you can imagine, this is very tight quarters, and sometimes visualization is very difficult. When we look at laparoscopic hysterectomies, a surgeon utilizes a lit camera laparoscopically and uses rigid instruments through small incisions in the belly and up in the umbilicus. The surgeon will utilize a video screen outside of the body during the procedure to provide visualization within the abdominal cavity. When we look at robotic-assisted laparoscopic hysterectomies, this is a safe and effective surgical approach. It allows the surgeon to control sophisticated robotic surgical tools from a surgeon's console. The advanced instrumentation provides the surgeon wristed instruments and 3D visualization of the surgical field. Your hospital stay is usually 1 day, with a return to normal activity within 2 to 4 weeks. Looking at advantages of minimally invasive approaches, we see that women are able to recover quicker, allowing for a quicker return to work and daily activities, shorter hospital stays, less pain and scarring, and a lower chance of infection. Recovery periods include on average 3 to 4 weeks from a minimally invasive approach, as opposed to 4 to 6 weeks on average from an abdominal approach. What are some of the reasons for a hysterectomy? Hysterectomy for benign procedures after all other treatment options have been attempted. The major reason for women receiving hysterectomy procedures involves uterine fibroids due to persistent pain or bleeding, the development of a uterine prolapse in which the uterus is dropping through the vaginal canal. Adenomyosis, in which we have the uterus muscles are thickening and the glands are swelling. Cervical dysplasia, in which you notice recurrent abnormal pap smears with dysplasia. Abnormal vaginal bleeding, chronic pain, and then last but not least, cancers of the uterus, cervix, and/or ovaries. When we look at the procedure techniques for hysterectomy, we have supracervical, which is known as a subtotal hysterectomy, of removal of the uterus while the cervix is left behind. A total hysterectomy where both the uterus and cervix are removed. A radical hysterectomy, generally performed for cancers of the uterus, cervix. The sides of the uterus and the top part of the vagina are both removed. And then we have oophorectomy, in which the ovaries are removed during the procedure. And this is looking at some of the advancements towards less invasive surgery. When we notice the vaginal approach at the top, the abdominal incision to the left. The next one is the laparoscopic procedure. And then we now have the robotic assisted surgical multi-port system. There's been over 2 million procedures performed worldwide. Some of the advantages of looking at robotics, as well as looking at the 3D vision where we can have up to 10 times zoom. We have the wristed instruments which articulate, and it enables intuitive control of these handheld instruments. What are the potential benefits for a Da Vinci hysterectomy versus an open surgery? Fewer complications, minimal scarring, versus an open traditional versus laparoscopic, less blood loss, shorter hospital stay. And then when we look at robotic hysterectomy versus a traditional laparoscopic surgery, a lower conversion rate to open, which means that you started the procedure laparoscopically or robotically, but the complications warranted to go to an open procedure. With this, we have a lower conversion rate with robotics as compared to laparoscopic. And then something that's becoming a bigger and bigger issue, not only in the United States, but worldwide, a less need for narcotic pain medication. Thank you for taking time to listen to this presentation. And if any questions or concerns, please do not hesitate to contact our office. Thank you.